The first major national strike by doctors through the Uganda Medical Association first took place in November 2017, grinding service delivery in major public health facilities to halt. At the time, the leadership of UMA raised issues critical to the welfare of medical personnel that they believe had been neglected by government, which among others included chronic shortage of medical supplies and technologies, unemployment of medical doctors in the positions available in health centers, delayed salary enhancement as directed by the president, as well as failure to provide health insurance to health workers.
We cannot keep giving a service where what we need to use is in shortage. A case in a point, I did over 4 surgeries in a specific hospital that I won't name, but I was using the same scrubs over and over.
5 years later, newly elected UMA President Dr. Samuel Odong has expressed disappointment that the same issues are still plaguing the health sector and affecting the medical personnel's performance.
We deal with lives. We do not have business running around. Our business is purely saving lives. Please, let this be put into action and implemented.
Odong points out that the situation has been exacerbated by the outbreak of COVID-19 in the country.
You find a doctor who is attached to emergency unit is actually using the same mask over and over. And the same cases is reviewing, others turn out to be COVID positive. Imagine that exposure.
Until these issues are addressed, Odong says they will not pick up their tools again.
I call upon all doctors who are out there to take this starting from 00 hours today, midnight, the industrial action will be implemented.
However, during an interaction with the Uganda Nurses and Midwives Association on Friday, Permanent Secretary to the Ministry of Health, Dr. Diana Atwine, noted that they were indeed aware of these issues and were working around the clock to resolve them.
The challenge has been Ministry of Finance to realize these funds in time to make sure that we increase the salary from the time that he directed.
The industrial action by doctors comes barely a week after medical interns through their association, Federation for Uganda Medical Interns, also laid down their tools, accusing the government of not fulfilling its promises to improve their welfare. Joyce Nakato, NTV Weekend Edition.